Shoulder pain is something, well, many of you listening have probably dealt with it, right? Especially if you're middle-aged or older.
Hmm.
And a really common reason, these rotator cuff tears.
Exactly.
Now, often, rest, physical therapy, that can work. But sometimes that pain just sticks around and surgery ends up being the next step.
But the traditional way, the surgery involving anchors to fix the tendon back to the bone, well, it can mean a long recovery. And there's a risk of stiffness afterwards, too.
Okay, let's unpack this a bit because there is a newer approach that's showing some real promise. Bioinductive collagen implants.
Yeah, and this is interesting because it's not about mechanically fixing the tear in the same way.
No.
It's more about encouraging your own body to regenerate that damaged tissue. It's quite a different philosophy.
This gives us a look into maybe a different future for treating certain kinds of these tears, perhaps avoiding some of those older surgical downsides.
It's fascinating, this move towards using the body's own healing power instead of just relying on hardware.
It's the clinical outcomes of a bioinductive collagen implant in rotator cuff tears.
Right. And we want to understand how effective these implants are.
What does bioinductive actually mean here?
It means they're designed to prompt a biological response from your body, to encourage it to heal itself, essentially.
Okay, so the goal here is to give you the inside track on a surgical option that, well, it might mean a faster recovery, maybe less pain, for a really common shoulder problem.
So let's start right there.
Yeah.
What exactly is a rotator cuff tear? Why does it cause so much trouble? Stability for movement. So an injury like this, it can cause pain, limit how you move your arm, and really impact your day-to-day life. Your quality of life takes a hit. Yeah, because the symptoms that ache, maybe trouble lifting things, can feel a lot like other shoulder issues.
So that tees up these bioinductive collagen implants perfectly. Tell us more about this approach. What is this implant and how is it supposed to work?
So the implant used here, the Regeneten implant, it's basically a scaffold made of collagen.
A scaffold.
Yeah, think of it like a framework. It's designed so that your body's own cells are attracted to it, they migrate into it, and then they start regenerating new tendon-like tissue. It provides a temporary structure to guide that growth.
Huh, so it's different from just stitching the tear closed.
Completely different. This implant is laid over the tear on that bursal surface. The hope is it stimulates healing within the existing tendon.
Interesting. Sort of kickstarting the body's repair process. And you mentioned earlier studies didn't always separate out the location.
They also did an acromioplasty.
What's that?
That's where they smooth down a little bit of the bone on the top of the shoulder blade, the acromion, just to make sure it's not rubbing or impinging on the tendon underneath.
Makes sense.
And the key step, they placed this collagen implant right over the tear on the bursal side. And again, really important to try and fix the tendon down to bone directly.
Okay, so the implant is laid on top.
So the therapist moves the arm gently. No active lifting or moving it yourself in that early phase. Oh, definitely. It's a gradual return. The goal was getting back to normal activities, maybe sports, over about 6 to 12 months. It depends on the person, of course.
Which, anyone with that persistent shoulder pain would be keen to get through that process.
They were looking to see if the implant had integrated, if the tendon looked like it was healing, and critically, if the tear had gotten worse or the implant had failed somehow.
All right, the moment of truth. Let's get to the results. What did they actually find? How did patients do?
The findings were, well, quite positive. Let's start with pain. The VAS scores. They saw a big drop in pain, and what was really striking was how early it happened. Significant improvement just 2 weeks after surgery.
2 weeks.
Wow.
That is a dramatic improvement in pain. What about function? Using the shoulder, did that improve quickly too?
It did improve significantly, but it took a little longer to show up statistically. At that 2-week point, function wasn't significantly better yet.
Okay, that makes sense. Still very early.
Right. But starting at the 6-week mark, the scores on all those functional tests showing significant improvement compared to before surgery. And that improvement continued steadily right through the 12-month follow-up. It really represents a substantial improvement in what people could do with their shoulder.
Sounds very promising.
The imaging results were very encouraging at both 6 months and 12 months, and the tendon tissue was healing successfully.
That is fantastic news.
So the collagen implant, by sort of covering the tear and maybe encouraging tissue regeneration to build better quality tendon tissue over time, improving the tendon's integrity. Potential implication is about the recovery, the rehabilitation.
Faster, maybe?
Yeah.
So maybe you can start moving it a bit sooner, more comfortably.
It might allow for an earlier start to rehab exercises, potentially leading to a quicker return to function compared to a traditional anchor-based repair.
If you have that persistent shoulder pain from a tear, and these bioinductive collagen implants are emerging as surgical alternative.